Helping Families Heal, Effective Treatment Modalities for Children in Foster Care. This presentation will be presented to the Cuyahoga County Division of Children and Family Services Supportive Services Department, along with the Metro Health Medical Center Foster Care Clinic. My name is Elizabeth Mekaloff, and I'm a counselor with the School Health Program for Metro Health Medical Center, along with a former employee of the Cuyahoga County Division of Children and Family Services. The purpose of this presentation will be to review the data of the number of children in foster care, both nationally and locally, discuss intergenerational trauma, look at the treatment modalities that have been historically used for children in foster care, along with taking a closer look at eye movement desensitization and reprocessing, EMDR, and trauma-focused cognitive behavioral therapy, TFCBT, and looking at what the research says about these two treatment modalities regarding children in foster care. The data. Nationally, there are 144,818 children in foster care. In Ohio, as of September 4th, there were 18,878, and of those, 2,690 of those children in foster care are from Cuyahoga County. The last two bullets let you know where I got my information from. State and local information was located on the Interactive Children's Services dashboard of the state of Ohio. So for those of you who work for Children's Services, if you want to know how Cuyahoga County ranks compared to the other 87 counties in the state of Ohio, this is the dashboard you would go to at any moment in time, as it's current up-to-date data as of every day. Intergenerational trauma. The American Psychological Association defines IGT as the transmission of trauma and its legacy in the form of psychological consequences of an injury or attack, poverty, and so forth, from generations experiencing the trauma to subsequent generations. For those of you who work for Children and Family Services, I'm sure there's names that come across your desk that you may have seen over and over again with a long history with Children and Family Services. A common phrase heard when discussing intergenerational trauma is epigenetic, and this is how life experiences in the environment influence gene activity. It doesn't change your DNA makeup, although it does change how you handle things, what you're experiencing. Parental adverse childhood experiences, better known as ACEs, is something that also can be considered when looking at intergenerational trauma, as there's data to show that parents that have experienced 4 or more adverse childhood experiences have a tendency to struggle with parenting, and whose children are often diagnosed with things such as anxiety and ADHD. Unresolved trauma by the parents that we work with also can lead to attachment issues and the inability to parent their children effectively. The treatment modalities that we will look at are cognitive behavioral therapy, dialectical behavioral therapy, art therapy, multi-systemic therapy, EMDR, and TFCBT. Historically, the first 4 that I named are ones that we have here in Cuyahoga County have utilized to treat children in foster care. Cognitive behavioral therapy is simply the restructuring of negative thoughts, whereas dialectic or DBT behavioral therapy is restructuring of thoughts, but with some mindfulness and acceptance-based techniques. Art therapy is just what therapy, it's in the name. MST is often utilized with the juvenile court system. It's a more intense therapy that is done in home where the other ones are most likely done out of the home in a therapeutic setting. EMDR is something that has been historically used with victims of post-traumatic stress. You can often hear police officers or war veterans that have utilized EMDR. And TFCBT is also a more recent one for those of you that have any extended history in child welfare. We've often used CBT. TFCBT is more of a trauma-based service that is now being utilized for children in foster care. I'm going to take a quick minute to look at comparing EMDR or TFCBT. So EMDR basically is a treatment that uses what is called bilateral stimulation. Sorry about that. And this is often known as tapping, or where the therapist may use their fingers to go side to side to help the child reprocess their thoughts. And it's focused mainly on the intensity of memories. It's 8 phases long. Parent involvement is optional. And there is some rapid symptom relief. EMDR tends to work quicker in children than it does in adults, as the memories may not be intense or have not been around as long. So that is one of the benefits to doing EMDR with children. TFCBT is a combination of the CBT techniques I spoke about earlier with trauma-sensitive interventions. This is the purpose of this is changing thoughts, reducing symptoms, and learning coping skills. It could tend to be a little bit longer, as it's 12 to 25 structured sessions. And sessions usually last about 90 minutes and require either a parent or caregiver involvement. TFCBT helps both the parent and the caregiver and the child, whereas EMDR, since the parent involvement is optional, it will benefit the child if the parent is not involved. The challenges: parental involvement. When a child is placed in foster care, it's often difficult for a parent to be available to participate in TFCBT. The sessions are 90 minutes long. Therefore, a child may need to miss school. Therefore, it makes it a little bit more difficult. With EMDR, it's child focused, so therefore the parent may not be getting the treatment they need in order to help the child. EMDR requires trained clinicians, and they are limited, as does TFCBT. There is some training that a clinician needs to go through, so those are also limited. The length of the treatment, as I stated a little bit earlier, is often a challenge, along with, for TFCBT, if there's a placement disruption and the caregiver is no longer available that the clinician has been working with, this could also be a detriment to the service that the child is receiving. What does the research say? Both modalities are effective in treating children in foster care. Treating the whole family is paramount. Therefore, EMDR may be utilized with a child, but maybe along with some family therapy for the whole family would be more beneficial. It is necessary to do further research on the effectiveness over time for both treatment modalities. and further research on the effectiveness with minority children is needed for both CBT, TFCBT, and EMDR. These are the resources that were utilized for my presentation. If you have any further questions, you may reach out to me at 216-403-4899. And I thank you for your time and attention to this matter.